Advancing Climate Adaptive Public Health System in South Asia. And we have here Professor Kausar Afsana from James P. Grant School of Public Health, who will be moderating the session and engaging with the panelists. So may I request Professor Afsana to take the floor?
Thank you. Hello. Hi. Good afternoon, everyone. Assalamu alaikum. A very warm welcome from Bangladesh and South Asia to our session, which is Advancing Climate Adaptive Health Systems in South Asia. And firstly, I would also like to thank the organizers, especially the United Nations Climate Change Global Innovation Hub and COP28 UAE for giving us opportunity to speak. So can you please show the slide, please? And we have should be five. Now at this moment, we have 3 distinguished scholars from South Asia region. And we will have 2 more speakers, but I don't see them as yet. Hopefully they'll be showing up. Can you please show the slide, please? Okay, next slide. Okay, I'll use the clicker. Okay. So this, this is about the Sustainable Development Goal, climate change and health in South Asia. And so if you can see here that what is happening in Sustainable Development Goal. And South Asia, we have 9 countries actually are comprising South Asia. So our population is 1/4 of the world population. Imagine that how huge we are. And but for the SDG score, if you look at it, the annual average SDG score is 64.1, which is a little bit higher, 3.20% higher than 2015, which was the baseline for SDG. And if you look at the scenario of SDG progress in different countries, and I just picked a few because Global Goal 13 SDG is climate action. Look at it, that the countries which are 7 countries from the out of 9 are on track in SDG 13. And 8 countries moderately achieving SDG 3, which is good health and well-being. I can see here. I hope that I can show you. Yes. 3 countries are on track, and 6 countries moderately achieving SDG 6. So these are climate-associated ones which are impacting health. That's how I wanted to show some of the glimpse of SDG which is progressing or may not progressing. You can see that SDG 15, which is life on land, countries are in decline. That includes all 9 countries. So that's the scenario of Sustainable Development Goal in all the 9 countries of South Asia. But think about, even if you are countries on track in some of the areas, but within the countries there are many disparities, inequity still exist. So you have to keep this in mind. So next slide is about, as will be speaking about health and climate. So you can see that I couldn't get data from South Asia. My colleagues will be speaking. So 7 million people killed by the combustion of fossil fuel every year. That number it might increase. But Southeast Asia, we all know by this time, or we all know about this, that the least per capita emitter of greenhouse gas emission, but we are mostly vulnerable and hugely impacted by climate change. And healthcare sector that is associated with health is the 5th largest emitter, responsible for nearly 4 to 5% of the global greenhouse gas emission. So imagine that we are actually from health sector, how we are contributing to also climate crisis. And health sectors in South Asia, which is actually contributing to 2% compared to North America, that contributes to 29%. So, you know, these are very important who are working in the field of health. And we know that if you're not healthy, you cannot contribute to many of the things that we are all trying to achieve. So global, especially the GHG, if it will triple because from now and 2050, if we, with a drastic impact on health, devastating impact on the health, if we cannot cut down our carbon footprint, that's really important. And as I'm talking up from health sectors, that means that health sector needs to be also very responsible and responsive. And this is climate and health. There are many, many changes that is happening due to climate change, and that is affecting health. And when it means health, that means we are having deaths and diseases that is happening due to all those things that, you know, at the outskirts of the circle. Next slide is the South Asia health impacts. So we don't have any data, but as I wanted to say that South Asia is, we can see that, you know, the upsurge of what is happening about this zoonotic diseases, vector-borne diseases, I mean, all with acuteness, with chronic diseases, NCDs are coming up. We can see also in mental health, but some of the things are still not very much prominent, like sexual reproductive health and child health, adolescent health, which are also very critical, even for elderly health. These are very important to see that what are the things are from climate change, it is impacting on the health as a whole. So that the fatalities is critical because on the other side, you can see that how it is impacting our social development and economic development as well. So with that, I think I'll go to the next speaker, Farzana Misha, but with this, our panelists who are coming here, in fact, they will be giving you more about that, what are the transformation we are expecting from the discussion we'll have that is impacting on health, and how can you be more responsible or responsive. And there will be some examples from the country that would show that it's possible, but maybe long time to go. But with this, I'll introduce the first speaker. Our first speaker is Dr. Farzana Misha. She's assistant professor from BRAC James B. Grant School of Public Health, BRAC University. And Farzana, you have a question, but maybe you know that what I'm going to ask, but for the sake of our audience, her question is to advance climate adaptive health systems, how Farzana is going to explicate the current implementation process and what progressing are being made so far in South Asia. With this, over to you, Farzana.
Thank you so much, Afsana Appa. Hi, everyone. I'm Farzana Misha, assistant professor from BRAC School of Public Health, BRAC University. So, as you can see, today we are going to talk about implementation, progress, challenges, adaptation, and future pathways, all regarding the health system. So from the latest IPCC report, most of us, we already know that it's going to get harder to adapt because it's going to get worse. We are going to see 250,000 additional deaths per year from 2030 to 2050 from malnutrition, malaria, diarrhea, and heat stress alone. Vulnerable regions, they are already experiencing more deaths per year due to climate change. During the last decade, it was 15 times higher. And also, IPCC highlighted that areas with weak health infrastructure, they will be the least able to cope without assistance or preparation. So what's happening in South Asia? So as you can see from the graphs, South Asia is going to experience the second highest additional deaths from 2030 to 2050 due to climate change. So So far, I believe more or less we have some idea like how climate change is impacting health, but today we are going to talk about a health system. So from this, you can see that due to climate-related hazards like heat, air pollution, water scarcity, there are the health outcomes because of climate change, which is health-related, heat-related illness, waterborne diseases, vector-borne diseases, mental and psychosocial health. And depending on factors like demographic, geographic, socioeconomic status, there is an added layer of vulnerability. But if you see, look at the health system, when all this is taking place, the health system is under pressure as well through people and communities, the health infrastructure, energy, water, and food system. And down below to the right side, if you see how health system and health outcomes from climate change, they are kind of influencing each other. So if patient load increases because of climate change, it's putting pressure on health system. But then again, if the health system is not climate resilient, it becomes difficult for them to cope with what's coming, and as a result, the caseload keeps increasing. And also, as you can see, that it's critical, the health system itself is climate friendly. For example, there was this recent study that said if global health system was a country, it would be the 5th highest carbon emitter. So another thing I would like to remind you all is when we talk about all these taking place, it's not going to come one after another. It can happen simultaneously. So here is a picture of from Munshiganj Government School in Bangladesh, which is also a school come cyclone shelter. So this picture is from 2020 when Cyclone Amphan hit Bangladesh, which was in the middle of COVID-19 pandemic. So for health system adaptation, we need to know what climate resilient health system is. So according to WHO, as you can see, a climate resilient health system is one that is capable to anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stress. So what does it entail? So for this, there are some, what's critical is this being reflected in policies. So for example, that's our first priority. And second is to anticipate what's coming our way. We need a strong early warning system for extreme weather events and also effective health surveillance. If we have those, then based on the capacity the health professionals and health system has and infrastructure resilience, we would be able to respond, cope, and recover from climate-related shocks. And from the learning from all these, we can come up with a design that will make this health system more adaptive, which should be reflected in the policies as well. So it's like a cycle, and we have to be aware of that. So how much have we reflected on building resilient health system? So there were a number of initiatives that took place by government in South Asia. For example, almost most of the countries in South Asia, we have our own national adaptive plan, which is impressive. But then the question is building climate resilient health system has been reflected in these policies. So from my experience, most of them, they did mention health. They did mention how climate change is going to impact health. They did mention that we need to build a good health surveillance system, early warning system. But then again, what's missing is the objective for keeping all these in the policies. So far, it shouldn't be like, okay, it's a checklist. We have to have a surveillance. We have to have an early warning system. But what's the prime goal? The goal is to build a climate resilient health system. But good news is there were some initiatives from government and also private institutions or organizations. For example, in Bangladesh, recently there was this initiative where 18,000 community clinics and hospitals are going to be using renewable energy. Examples like this could be seen in India, Pakistan, Nepal, Sri Lanka, etc. So now moving forward, health and climate synergy. So I think what I'm going to talk about now is also a response to Afsanapa's question. So what I think is for countries in South Asia, which is a very climate vulnerable region, what we need to have is an overall understanding of climate adaptive or climate resilient health system. Because it's not like climate change is going to impact our health, and that's why we need to be prepared, and this is what we're going to do, but we have to think ahead. Before it strikes us, we have to be prepared. So overall understanding is crucial at the policy level, private level, even in the education system. Second is a set of indicators to measure adaptation, because if we say that we want to build a climate adaptive health system, we need to be able to measure it. So we need to have a number of indicators depending on which we can decide, look, okay, so this is how far we have come, and this is how far we need to go. We need to mainstream health in national climate strategies, which already started, but then again, national adaptation plan, we have to remember it's not health focused, it's for everything. So there was one initiative by Bangladesh government to come up with health national adaptation plan, but unfortunately it still didn't come out, but that's something we can think of for all the countries in South Asia. Integrating health priorities in NDCs, my fellow speakers today, they will talk about it in detail. And last but not least, a knowledge sharing platform, because what we have seen in South Asia, what we face in terms of climate change, climate crisis, more or less it's the same. But if we had a knowledge sharing platform, then we could learn from each other, which would make it easier for us to come up with a solution. It can be an adaptation solution, it can be a mitigating solution, but it would be beneficial for all of us, and it will be less time consuming, and we can make sure we don't, like it's successful the first time, not learning from our mistakes. So I think that's all from me.
Okay, thank you so much.
I hope I didn't go beyond the time.
Can you hear me? Is it working? Thank you, Misha. I have one more question for you. I know that you have already mentioned many of the challenges, but would you like to share any specific challenge that South Asia is facing at this moment?
I would like to mention the knowledge sharing platform, because there was this project that in BRAC School of Public Health we are conducting at the moment, which is on mental health and climate change, where we are a regional hub with Imperial College London. So there we are the regional hub for overseeing 14 countries in Central and South Asia. So there were 2 dialogues that took place where we shared what each country is going through and how we are tackling those, facing those, what strategies, what interventions are at place. So what we realized that more or less what we are facing is same. More or less in terms of economic condition, it's the same. But then again, the fact that in each country, almost all the countries, we are coming up with solutions, but we are totally unaware that the country next to us, they already found something that's effective. If only we knew that, maybe we could, follow their footsteps. It would be easier for all of us as a region, given the crisis we are facing. It's same for all of us. I hope that answers your question.
Yeah. Thank you, Misha. I think, that means that we need to have more regional cooperation. Thank you. And now I'm going to call upon our, thank you, Dr. Dinesh Tiopen Assistant Scientist from International Health System Program and Department of Epidemiology, Bloomberg School of Public Health, Johns Hopkins University, USA. But Dinesh is actually from Nepal. He's a Nepalese. So Dinesh, I have a question to you that you have actually have great example from your research in Nepal of a specific population affected by extreme weather effects. Can you please share with us?
Thank you so much, and I'm really sorry for my bad voice, and also sorry for being late as I went to another building. So good afternoon, everyone, and so I will share on this platform particularly related to the heat exposure and chronic kidney disease of non-traditional origin, focusing in Nepal and Nepali workers. So Nepal is not an exception, as we have seen all over the world the effect of climate change, and more news are coming every day, the scarcity of water, landslide, flooding, and so on and so on. And also, if we look on data, what we are seeing in Nepal is that there is increasing burden of zoonotic diseases. There is increasing surge on vector-borne disease, and there is increasing surge in COPD and lung diseases. So one thing that it's not only for Nepal, but all over the world, what we are not focusing is looking the effect of heat exposure on human body. Where does it affect? Does it affect your kidney? Does it affect your heart? Does it affect your lungs? Or what are the direct effects? There is a lot ongoing on the indirect effect or direct effect, whatever way you call. But one thing that what effect do we have because of the exposure to the high heat environment? So as you can see, can I use this? Maybe not. Okay, so exposure to heat, it develops the heat stress that come from environmental heat and internal heat from muscular work. And then this will increase risks of heart stroke, increase risks of acute kidney injury and chronic kidney disease. Also, it increase accident risks and also reduce productivity, and that may result in early mortality. So now I will particularly focus on chronic kidney disease of non-traditional origin. What is it? So it is a kidney problem, but there is a difference between the usual chronic kidney disease and chronic kidney disease of non-traditional origin. The chronic kidney disease usually we see among older people, both in males and females, and they have the underlying condition like diabetes, hypertension, or obesity, and can be diagnosed by proteinuria test. And we can find all over the world, mostly in the high-income countries where they have the aging population. Whereas chronic kidney disease of non-traditional cause, it disproportionately affect the working age male population. And it's those who are working, thank you, those in the hard work, working very hard, and also without sufficient access to water, rest, and shade. And it can be diagnosed with serum creatinine only, so it is a little bit complex. And mostly so far, we have a limitation on the data, but so far what we see is that this problem is in Central America, South Asia, and other tropical lowlands. And we are not talking about rocket science to prevent kidneys. It is very simple formula, basic, that we have not been able to apply for so many years. The basic protection, what we are missing for so long are give the break for the workers and provide the shade and provide drinking water, provide the toilet for urination and maintain the hygiene. That's it we can do so far for protecting kidneys from heat exposure. And our team had done a very important project in South America among the sugarcane workers, following these 4 measures: scheduling the breaks, providing the shade, clean water and hydration beverage, and importance of good hygiene. And what we have found from that project is that it does not only cool your body temperature, which probably you all know, but it also increased the productivity among the sugarcane workers. So by following this, it's not only about the health, it's about also the productivity, where business sector is mostly interested. So it will give both benefit for the workers and for the employers as well. And now coming back to Nepal, and in Nepal, as many people are working abroad as many in Nepal right now. It is one of the country sending the workers in the Gulf countries and Malaysia. And we know this is a hotter climate, they are moving from Nepal. And there are some initiatives ongoing. I don't want to go on the midday ban whether it is an effective measures or not, but at least there are some efforts ongoing to do some kind of prevention activities. So this study among 38 nephrologists from Nepal, what they concluded is that returning migrant workers could be at higher risk of kidney health related problem compared to non-migrating Nepalese population. And then we did another cross-sectional study among 350 patients who are currently undergoing dialysis in the leading dialysis center in Nepal. And this was a cross-sectional study. We recruited patients between 18 to 80 years of age. And then what we have found is that returning migrant workers, those who are under dialysis, were younger, predominantly male, and they have less underlying morbidities like diabetes or other immunological diseases. More often work outdoor under high heat. Those who are currently under dialysis are more often work outdoor under high heat. And those returning migrant workers, they did not have any medical condition prior to their foreign employment and returned to Nepal due to new health issues. And 36% responded that they work extremely, they had a high workload environment. And 67% of them told that heat exhaustion during the last foreign employment. So this was from hospital-based study among the dialysis patients. So this definitely tells something is there. We need to look more closely whether heat exposure really have an effect. And thank you, I'll finish. So this is my last slide actually. So now we are currently doing a population-based study looking the heat exposure and the chronic kidney disease among not only particularly focusing on the migrant workers, but also the workers in Nepal who are exposed to the high temperature as well. So I think there is still a lot to be done, but at least now we have started this work. But one thing that I want to say by wrapping up that a 35 years old man who has to go to the dialysis and cannot replace the kidney, there is no way that that person will survive long. So the way how we can prevent is that, again, I told that very simple measures that we need to implement, and we have the evidence that it not only cool the worker's body, but also it increase the productivity. This model has not been tested in this site, but we have the evidence from South America. I'll wrap up here, but I'm happy to take other questions. Thank you.
Thank you so much, Dinesh. But one more question, because this is so important, especially not only for the migrant workers, even the workers who are actually working in our own country, right? And that means that it should be, so could you please reflect in one?
Yeah, we just completed another study among these sanitary workers. I don't like to use the garbage workers, that may not be the right term, but we may be sanitary workers or maybe the right term. So we are now doing the research on how to map the heat exposure. It's not so easy. It has many dimensions that need to be captured about the heat exposure. So we are also equally interested to look on within the country, in Nepal, probably in larger South Asia as well in future. But we are also looking that. I don't have data, unfortunately, but we are working on that as well.
Thank you very much.
Thank you.
So our next speaker is Purnima, Dr. Purnima Prabhakaran. She is the Director of Center for Health Analytics Research and Trends, Trivedi School of Bioscience and Ashoka University in India. And she was before as the director of Public Health Foundation, working as a director for Center for Climate Change, right? In Public Health
Environmental Health
Foundation of India. Thank you, Purnima. So I have a question for you that you have so much experience in working in this specific area, I mean, climate change and health. So you'll be, please tell us about your South Asian, how South Asian countries are participating in terms of, allocating the NDCs, including at India, to advance a climate adaptive or resilient health systems.
Yeah. First of all, good evening, everyone, and I want to record my appreciation to the organizers, Professor Afsana, Bidan for the introductions, and the Global Climate Innovation Hub for the opportunity to host this very important dialogue in this platform. At the outset, we've heard about the SDGs from Professor Afsana, and we heard the context setting and then a real research study in the area. But I want to just take you back one step to reflect on the NDCs, the nationally determined contributions. And for most of us, this is no news, but just to bring everybody on the same page, the nationally determined contributions are country commitments to emissions reductions to deal with climate change. And as per the Paris Agreement, the countries, every nation is supposed to update these nationally determined contributions every 5 years. So a couple of years ago, just before, at the Glasgow COP in 2021, there was a fervent appeal actually to all nations to reconsider and enhance their NDCs, simply because of the increasing recognition that there was a gap between what is being committed and what is required to actually achieve the 1.5 degrees Celsius, if not the 2. So really what happened after Glasgow is the question that we've been asking in terms of the NDCs. And not all countries submit at the same time. They do it at their own 5-year cycle. And for us working in the health sector and as professionals working with people in the health sector, I think what was most important for us to understand was how much of the NDCs reflect or take into account the linkages to health and health systems, which is the focus of our conversation here. And thankfully for us, there was this stock take of the NDCs in South Asia after the Glasgow COP by the Global Climate and Health Alliance, which many of us working in this space are now familiar with as the organization that has this convening power to bring together health professionals from around the world. And they actually did this study to look at, evaluate the NDCs that had been submitted from October 1st, 2021 till September 2022. And what they really did was to look into these NDCs. It was about 54 countries NDCs, and evaluate how much of these NDCs are accounting for health. And they formed, as a report, the Healthy NDC Scorecard. And what it did was look at 6 categories of evaluation in this assessment. They looked at integrated governance. They looked at health impacts. Was there any mention of health sector action? Was there any mention of co-benefits for climate action, health co-benefits of climate action, economics and finance, and monitoring and implementation? So each of these 6 categories was given a score of 3, so that we had a score of 18 for each country. And along with this, there was also a climate tracker assessment, which was actually looking at, in addition to the insights into the health mention in the NDCs, was there also progress in the overall climate ambition of countries? And this actually was important because sometimes there was a mismatch in what they were committing to in their NDCs, but also what they are doing in terms of overall climate ambition. So it was interesting what came out of this exercise, and I just picked the countries that were there in this exercise from South Asia region. That's our region of focus for this conversation. And you will see here the scores that countries like Cambodia, Indonesia, Myanmar, and Nepal had. And out of a score of 15 sometimes, because there wasn't data on a particular indicator, you can see the commitments and the linkages to health in country NDCs for small countries like Cambodia. Cambodia, Indonesia had somewhere, halfway in terms of achievements of linkages to health in their NDCs. Nepal had a score of 3 out of 15, and I'm not sure that's completely reflective of what is happening in that country, because most of us know, and Dr. Dinesh will endorse that there is a lot of work that's happening to develop climate adaptive health systems in Nepal. So while this exercise did try to kind of assess countries for their commitments and assessment of linkages to health, it also gave us a kind of a perspective in comparison to the developed nations. Look at the scores that UK or the United States of America or even the UAE, the current host of the COP, had, or a developed country like Singapore in South Asia also scored very poorly. So it gives us food for thought in terms of what are countries committing to in their NDCs. Are we really understanding the linkages to health? And from coming from a health day that we had in COP, is this something that we need to advocate for? If the commitments are not happening at country level and they are not seeing the linkages to health, then we all have a lot of work to do still. And I think what I took away from this also, the barometer that you see over there is actually the climate tracker assessment. So while Singapore scored poorly in terms of its linkages to health when it was talking about its NDCs, it also meant that it was catastrophic for health in terms of its overall climate ambitions. And that's not a very interesting fact for us to digest over here. And I think what we also started thinking about is, okay, if the countries are including health, are drawing the linkages to the health impacts of climate change, and also talking about emissions within their health sector, what are they expected to do next? And as we all know, we are all interested in developing climate resilient and adaptive health systems. And where do we go from here? This is where I want to bring a country example. I think overall what we need to do in order to build resilient health systems is first understand our vulnerabilities. Every country is different in terms of vulnerabilities, though you did say in South Asia, we do have similar vulnerabilities. India, for example, where I come from, we often call it countries within a country. Every state in India has its own climate risks and vulnerabilities. So understanding our risks and vulnerabilities, there are many tools out there. The WHO itself has a list of indicators for assessing our risks and vulnerabilities. And then go on, like Farzana mentioned, to develop our health national adaptation plans. And again, we have a lot of resources out there. Draw from WHO frameworks, the World Bank has its own framework. We need to develop our, not just national adaptation plans, we need health national adaptation plans. And once we have those, I think very decentralized implementation and governance is important for implementation on the ground. And of course, we need resources, optimal allocation of resources, and I hope multilateral banks or the other people who hold those money bags are listening to this, because this is important. We might have our NDCs linking to health. We might have our health national adaptation plans. But at the end of the day, for many of us, and South Asia region, this is very true, there is not enough climate finance to actually do the implementation at the end of the day. And I want to just call on the example from India, because we have a flagship national program for climate change and human health, which is hosted by the nodal ministry, our Ministry of Health. And this happened in 2015. The national program was established, but we quickly went on then to develop our national program for climate change and health with its framework for the national adaptation. And this was implemented in right earnest from 2018, but I was closely involved in the climate resilient health systems framework, and we started talking to them of not just, I used to use the term climate smart, which encompasses both resilience or adaptation as well as mitigation. And I think what we did was moved on to think about not just climate smart, but also sustainability in healthcare. And we did a lot of resource development for the country, which was used even during COVID through virtual webinars to sensitize the actors on the ground on what they need to do to develop resilience of their healthcare facilities. And I just want to flag also that we also did a top-down approach. Unless we bring this into our curricula, this cannot move ahead. And so we have a subcommittee now which is looking at bringing climate change and health into curricula, not just in the medical council, but also in the 5 other councils: dental, nursing, pharmacy, as well as the Indian systems of medicine. And this is just a snapshot of the framework that I have been closely working on to develop climate resilient and adaptive healthcare facilities. It takes into account a lot of different indicators, from site selection to building and infrastructure being resilient, natural resources like energy, water, and food being used optimally, as well as things like sustainable procurement. And the approach that we use is a very decentralized and customized approach for every state. And I just want to close with the key takeaways that we do need our national commitments to take into account health, but it must underpin the UNFCCC principle of common but differentiated responsibilities. Every country can't do the same thing. And we need to keep that in mind. Emphasis on the health co-benefits of climate action, facilitating countries in their journey towards climate adaptation, learning from best practices, mobilizing climate finance, and of course, platforms for learning like the knowledge platform that you mentioned. We also established one called the Consortium for Climate and Health in South Asia, again, a platform for cross-learnings and taking the agenda for climate and health forward.
Thank you so much, Purnima. I wish I could give you more time, but it's over. And but can you give us any example of any country that actually did a very good health system due to the climate change? Any single country?
Health system
Just name
adaptation. I can give an example from my own country, from India. So in 2018, the state of Kerala, which is in the southern part of India, really faced the worst floods that we could have seen in that country. The primary health centers, which are the front runners of delivering healthcare services, were simply washed away. And rebuilding and coming back from that experience, I think what the state government did was to take into account historical flood levels, for example, and rebuild their PHCs, the primary health centers, taking into account what the flood risks are, but also simple things like moving away medical stores, the supplies, to the higher floors of the center, moving emergency services to the higher floor, having some barriers for the floodgates, so those kind of things. I think there's little examples which we document as case studies, but there are several more to learn from. So
thank you so much for your presentation. We learned a lot. Thank you. Now I'm going to call upon Professor Mala Rao. And she's a professor from the Department of Primary Care and Public Health, Imperial College London. And she has many hats. But anyway, over to you, Professor Mala Rao.
Well, thank you very much, Madam Chair, Professor Afsana. And it's such a privilege to be here and to be participating in this session on advancing climate adaptive health systems in South Asia. Today, I think the particular hat I'm wearing is as chair of the WHO Southeast Asia Regional Office's expert group on the environmental determinants of health and climate. So it's a privilege to represent that group here. Isn't it significant also that we're meeting on a day when the theme of COP is food, agriculture, and water? And so, what I could add to all the amazing facts and figures and suggestions given by all of my co-panelists is what we further do with the NDCs. And so that's what I'm going to be focusing on. Let me see if I can, here we are. So it's food, agriculture, and water. So let's see how we make those sort of linkages. Where's my slide 2 gone? Okay, slide 2 is gone. Never mind. Before I begin with my major part of my presentation, I did want to acknowledge both you, Professor Afsana, and Dr. Misha, and in particular Adnan Kader from WaterAid Bangladesh, for brainstorming with me the sorts of things that might be useful to highlight in this session, and also for giving me a case study, which I hope I'll have the time to share with you all in this session. Having been one of the people who had hoped for over a decade for health to become the currency of COP, you know, it's a matter of enormous celebration at this COP28, because, you know, here we have the health declaration's been unveiled, and we've got health firmly placed at the heart of climate action. But against that background, here are the uncomfortable questions. How do we translate health into climate action? How do we begin to embed health into agreed instruments to drive climate mitigation as well as adaptation? Because we all know that adaptation alone is not going to work. We are forever chasing a goalpost that's moving. The floods are going to come more frequently, they're going to be more severe, they're going to be higher, and so those goalposts changing compels us to recognize the place of mitigation. And we have a massive job on our hands to push to embed that into our plans. And the best chance we have is, of course, to consider putting them in our nationally determined contributions. As Purnima has already mentioned, they are primarily intended to set out what countries do against the Paris Agreement, but they're also a crucial means to get health protection and how we improve the survivability and health of our populations sorted out into nationally determined contributions, and to bring about that interconnectedness between health and climate. It actually surprises me. Don't we all here probably believe that surely people must know that climate is affecting health? And yet even chance conversations at this COP28, even on the metro, while I've been traveling back to my hotel with bankers, people who are here from banking and financial systems, has made me realize how few actually consider the health impacts of climate change. So that really needs to be sorted out. But what this requires is firstly an assessment of health risks. And Purnima alluded to that. Do countries actually know how to assess the full range of health risks? Do they know how to identify the health co-benefits of proposals they're putting into their national determined contributions? For example, even greenhouse gas emissions and their reduction from things like active transport, and the numbers of people who will be saved from having asthma or dying from respiratory disease, just for one example. And then being clear as to how that could be integrated into climate policy. Do they actually know how to do those things? And here are some examples already mentioned, I think, in Dinesh's elegant slide, of where there might be some consideration given to how these health risks that we know can also be considered by those from the non-health areas that are working on NDCs. Take heat stress. And Dinesh gave us the perfect example of we need the construction industry here to sort out our health problem of kidney disease. Healthy urban planning, of course, is not in the gift of people from health, but it's in the gift of the construction industry and urban ministries. So, there are other things, standing water in construction sites. Do something about that, and you've got, a chance of beginning to reduce vector-borne diseases in urban areas, and so on and so forth. So, and mental health, since so many of us are engaged in that, addressing the mental health impacts of climate-related events by having really good, robust disaster management plans. How many have those, you wonder? So how are these being estimated? Purnima talked about the Global Alliance and how they are building up a scorecard of whether people know how to, nations know how to do this or not. I'm going to pick the WHO 2023 review of health. What did it say? 91% of parties did mention health. However, only 30% spoke about some health co-benefits and 10% knew how to monitor it. So the basic suggestion and recommendation at the end was loads to be done before we get this right. I also studied the 2021 updated Bangladesh NDC. So much scope in there, from their energy plans, their transport, forestry, agriculture, to start embedding health. So there's a role for you, Afsana and Misha, to advise the ministries on how they might do that. But probably the biggest opportunities are offered by addressing air pollution and water management. And now the science, oops, what happened here? So the science is so good that it should become easier. And I'm going to end with one a case study, because this is something we're not considering in linking health with NDCs as yet. Here's a picture of Geeta Roy. She comes from an extremely water-challenged coastal area of Bangladesh, Tengrakali village in Satkhira region. Now, she has been trekking for miles, for years, to get that bucket of clean water, gets together a group of local women when she hears that WaterAid Bangladesh is there and helping people out, gets together with WaterAid Bangladesh and Rupantar. And what do you have it? The Morichap drinking water plant, which these women manage themselves. It's now even a platform for a bigger water entrepreneurship for women's empowerment, the elegantly termed WeWe initiative. And it demonstrates, and they're turning around a little profit, these women. They are supplying water to themselves and they're supplying water to neighboring villages. You know, I mean, such an amazing story. What it demonstrates, though, is the need for NDCs to start building into them projects which are community-led, women-led, you know, because they really are good leaders here, community engaged, estimate the health benefits of such projects, and get on and build those into NDCs. I mean, that would be a true win-win. And the international community, my plea is at this session, help countries like Bangladesh and all of those that have far lower greenhouse gas emissions, but far higher burden of mortality and morbidity from climate consequences. Give them a hand and show them help them with the skills and building up the capacity for recognizing the health benefits that arise from national adaptation plans and NDCs, and then how to build those core benefits between environment and health and other ministries, but also how to estimate that through building those kinds of estimation and modeling techniques into the skills that they already have. So thank you, Professor Afsana.
Thank you so much. Thank you so much, Professor Mallarao. I have one question for you, that how can we do better in health and climate change when we witness that the developed countries are contributing severely to climate crisis due to unproportionately high greenhouse gas emissions? So I know that you mentioned about international community for local skills and capacity, but what we can do more, what they can do more on, to support the developed countries, including South Asia?
Well, I think, almost all of the kind of fortnight of COP28 negotiations and discussions have centered around that question, have they not, Professor Afsana? Because the injustice of climate is truly appalling, and it's becoming more and more exposed as the burden of impacts grows and becomes more severe and more alarming in the global south, while the global north, the emissions just carry on relentlessly. I think there are these sorts of questions to be answered by the loss and damage and the reparation and all of those sorts of things that are being thrashed out in other parts of this conference. But one thing I would say, which really struck me, is something that came up in a session on building climate-capable governments, which was led and hosted by an organization called Apolitical, that develops training programs and training courses. They conducted a survey of 200,000 public servants across 160 countries. And more than around 68% of their respondents, public servants, said that climate was already affecting their work. Around 63% said they had never had climate in their training until that point in time. Around 75%, if I recall the statistics correctly, said they expected the climate consequence to get worse and worse, the climate impacts. And around 73% said they would welcome climate training. And these countries were Global North and Global South. So one point I would make is we need better training of public servants, both in the Global North and Global South, to understand the links between climate and health and how it affects all of the ministries, not just environment, but the urban development, maybe justice, it could be transport, and how within their spheres of influence they can make a difference, and to understand that injustice and the inequality between the Global North and Global South. And that's our best way of getting public servants around the world developing more appropriate policies and bringing justice into this whole agenda. Thank you.
Thank you so much. So we actually had a last speaker, but I don't see him here. That he's our Mr. Saber Hossain Chowdhury. He's the Member of Parliament and also Special Envoy to the Prime Minister of Climate Change in Bangladesh. Unfortunately, he's busy with, unfortunate for us, but he's busy with our negotiation. So maybe he could be excused here. But if anyone from the audience could reflect anything, we have 2 minutes, I think. At this, yes. Yes, Farah Kabir from ActionAid, please, from Bangladesh.
What do I say in 2 minutes? First of all, huge thank you to the panelists. I'll take that. You keep hold on as the moderator. Huge thank you to all the panelists. Lots of things. You spoke about, I don't know, how do I do this in 2 minutes? So we have to prioritize health and climate change. There's no, but it's taken a long time for that nexus to happen. For us who work with the community, we're seeing the direct impact on them. And we're seeing the impact in terms of the whole life cycle. So from children to women to other issues covered by all of you. What I wanted to highlight, because it's only a very quick, is that our health budget doesn't even get, 50% of it doesn't get spent. And there's a misunderstanding between the software and the hardware. The hardware part gets very quickly done, infrastructure and so on. The services part is still missing. So is climate the hook, climate the pitch that will get them moving? And in terms of capacity building, there's a lot of work to be done. The denial is still there within our systems and procedures, and there's a huge lack of coordination. So what I was thinking is that you gave us some, all of you gave us some very interesting statistics and information. You need to give it in a form where those of us who are activists and doing advocacy and lobbying, and a lot of our activism and lobbying got the loss and damage, got the health into the nexus as well, we could take it up. So yes, in the end, it's the bureaucracy or the government, but there's a whole path leading. You know, after Paris Agreement, it was us who demystified what is Paris Agreement, what is SDG. You know, overnight, civil servants, or even us, we don't know, but we are part of the process. So there should be in that platform, knowledge platform, major spaces for activists and advocates to draw on policy briefs, draw on information that they can take. So don't keep the information as the custodian and expert, spread it. Thank you.
Thank you very much. So, yeah, we don't have any time to respond or reflect, but thank you so much to all all our distinguished panelists. Mala just came flew from India. Can you imagine? Dinesh came. So, you know, some information or some of the things that we wanted to share. And we learned a lot. From myself, I learned a lot that what we need to be doing. But we can understand that there are so many gaps remain. So in terms of capacity, in terms of financial gaps, even for evidence, we don't have that much of evidence. Even for climate change, we don't know that how much we need to invest in health, nutrition, food security. So much to do. So I don't want to take any time of yours. So thank you, panelists, and thank you, the organizers, for giving us the opportunity to speak. So we'll end and we'll take a picture.